okay. So if you're experiencing pain with sex, it could be just because you're not engaging in enough foreplay before sex. It could also be from things like vaginal dryness, so you may need to use a lubricant. You can especially be susceptible to vaginal dryness if you've just given birth, if you're breastfeeding, or if you are hitting into menopause. You could also have been diagnosed with a condition called vaginismus, which is when the muscles down there, aka the pelvic floor muscles, tense up involuntarily whenever you try to insert anything down there, whether it be a tampon or during sex. You could also be diagnosed with something called endometriosis, which is when the lining inside of the uterus grows outside of the uterus and adheres to your organs and tissues, and is often associated with pelvic floor tension, which causes pain with sex. You may also have just pelvic floor tension because those muscles are protective in nature, and they can tense up as a protective response when there's both external and internal stress in your body, whether that be from stressors at work, from a very demanding job, or a history of sexual trauma. Your muscles can tense up because there's a lot of important organs down there, such as your bladder, uterus, and rectum, that is trying to protect. It is so important that there's psychological and emotional factors that could also be contributing to your pain with sex, because fear about insertion down there can cause tension in the body, which can cause this painful sex experience. Which is why it's so important if you're having pain with sex that you look at all the different factors that might be driving your pain.